Find a mirror right now. Look into your eyes. Not at your eyes, into them. The whites, the colour of the iris, the tiny vessels on the surface, the skin around the lids, the way the pupil sits. Most people have looked into a mirror every single day of their lives and seen nothing beyond their reflection. A trained physician looks at the same eyes and sees something completely different. I have been practicing internal medicine for 15 years. In that time, I have diagnosed liver disease from yellowed whites before a single blood test was ordered. I have seen the early signs of diabetes in the blood vessels of the retina before the patient knew their sugar was elevated. I have identified anemia, thyroid disease, high cholesterol, autoimmune conditions, and, in 2 cases, intracranial pressure that required emergency intervention, all from looking at a patient's eyes for under a minute. The eye is the only place in the human body where blood vessels, nerve tissue, and fluid pressure can be observed directly, without a single incision, without imaging, without a blood draw. What a physician sees in your eyes in 10 seconds is a window into your cardiovascular system, your liver, your thyroid, your immune system, and your brain. Most people have never been told what their eyes are showing. Most standard appointments do not include the examination I am about to teach you. I'm Dr. Arthur Sterling. Subscribe right now and hit like. Look at your eyes as we go through this together. To understand what your eyes reveal, you need to understand the anatomy of what you are looking at, because the eye is not one structure. It is a collection of distinct tissues, each one reflecting a different aspect of your systemic health. The sclera, the white of the eye, is a tough, fibrous coat that covers most of the eyeball. It is threaded with tiny blood vessels and covered by a thin, transparent membrane called the conjunctiva. Changes in the sclera reflect changes in the blood, specifically in bilirubin levels, in hemoglobin concentration, and in inflammatory status. The retina, at the back of the eye, is a layer of neural tissue that is technically an extension of the brain. Its blood vessels are the only blood vessels in the entire body that can be viewed directly without any invasive procedure. The retinal blood vessels are a direct mirror of the cardiovascular system. Their caliber, their regularity, their integrity reflects what is happening in every blood vessel throughout the body at the same moment. The iris, the colored ring, changes in specific diseases. The lens, the transparent structure behind the pupil, clouds in ways that reflect metabolic disease. The eyelids and the periorbital skin, the tissue surrounding the eye, accumulate deposits and change texture in thyroid disease, kidney disease, and lipid disorders. The optic disc, the point where the optic nerve enters the eye at the back, swells when intracranial pressure rises. A swollen optic disc, visible during an eye examination, is a neurological emergency. It means pressure is building inside the skull. Here are the 8 things your eyes are showing right now that most people have never been taught to read. Sign 1. Yellowing of the whites. Look at the whites of your eyes in good natural light. They should be clean white with small pink vessels. When bilirubin, the breakdown product of red blood cells that the liver must clear, accumulates in the bloodstream, it deposits in the sclera first, before the skin yellows. Scleral icterus, yellowing of the whites, appears at a bilirubin level of approximately 2 to 3 milligrams per deciliter before jaundice becomes visible on the skin. This means your eyes show liver stress before your skin does. Before jaundice. Often before your blood tests become dramatically abnormal. If the whites of your eyes have a yellow tinge, not red from irritation, not pink from allergy, yellow, liver function is the priority investigation. Sign 2. Pale conjunctiva. Pull your lower eyelid gently downward. Look at the inner surface, the conjunctiva. In a well-oxygenated, well-nourished person, it is deep pink, almost red. When hemoglobin falls, in iron deficiency anemia, in B12 deficiency, in chronic disease anemia, the conjunctiva pales. A pale, washed-out inner eyelid is one of the most accessible clinical signs of anemia. Visible before fatigue becomes disabling, visible before the blood count reaches crisis levels. Sign 3. Xanthelasma. Look at the skin of your upper and lower eyelids, particularly near the inner corner of the eye. Are there any soft, flat, yellowish plaques, slightly raised areas of yellowish-white discoloration on the eyelid skin? Xanthelasma are deposits of lipid-laden macrophages in the eyelid skin, cholesterol-filled immune cells accumulating where they should not be. They are present in approximately 50% of people with familial hypercholesterolemia and appear in people with elevated LDL and dysfunctional lipid metabolism. They do not hurt. They do not itch. They look like a small yellowish patch near the corner of the eye. Many people have had them for years and been told they are harmless skin changes. They are not harmless. They are a lipid signal sitting on your eyelid. Sign 4. Arcus senilis. Look at the outer edge of your iris, the coloured part of your eye. Is there a white, grey or bluish arc or ring running along the outer rim of the iris? Arcus senilis, a lipid deposit forming a ring around the outer iris, in adults under 60 is a clinical indicator of elevated cardiovascular risk and dyslipidemia. The ring forms as lipid molecules deposit in the peripheral cornea from an oversaturated bloodstream. In people over 70, it is common and less diagnostically specific. In someone in their 40s or 50s, it is a finding that warrants a full lipid panel, including ApoB and LPA. Sign 5. The retinal signs of diabetes. You cannot see your own retina without equipment, but your ophthalmologist can. And what they see in a diabetic or pre-diabetic retina is specific and early. Microaneurysms, tiny bulges in the retinal capillary walls, are the earliest sign of diabetic retinopathy, appearing years before vision changes occur. They form because elevated blood sugar weakens the small vessel walls throughout the body, and the retinal vessels are among the most sensitive. If you have any risk factors for elevated blood sugar, family history, obesity, fatigue, increased thirst, a dilated fundus examination by an ophthalmologist is not optional. It is the only way to see your microvascular health directly. Sign 6. Thyroid eye disease. Look at your eyes from the front. Do they appear to be sitting slightly more forward than they used to? Is there a visible rim of white sclera above the iris when you look straight ahead? A staring quality to the gaze. Proptosis, forward protrusion of the eyeball, and lid retraction, where the upper eyelid sits higher than it should, exposing white above the iris, are classic signs of thyroid eye disease, most commonly associated with Graves' disease, an autoimmune hyperthyroid condition. The eyes protrude because inflammatory tissue accumulates behind the eyeball in the orbit. This process can damage the optic nerve if untreated. Sign 7. Kaiser-Fleischer rings. Look very carefully at the outer edge of your iris. In good light, is there a brownish golden ring running along the inner edge of the cornea, a ring that is distinct from the normal iris color? Kaiser-Fleischer rings, copper deposits forming a ring at the corneal edge, are pathognomonic for Wilson's disease, a hereditary condition where copper accumulates in the liver and brain. Without treatment, Wilson's disease destroys both organs. The ring is subtle and requires good lighting to see without a slit lamp, but it is there, visible, before the liver and brain damage becomes irreversible. Sign 8. The optic disc and intracranial pressure. You cannot examine your own optic disc, but if you experience persistent headache, visual changes, nausea, and pulsatile tinnitus, a whooshing sound in your ears, together this combination warrants an eye examination specifically looking at the optic disc. Papilledema, swelling of the optic disc from elevated intracranial pressure, is visible on fundoscopy before the patient loses consciousness, before imaging is performed, before the pressure becomes life-threatening. It is one of the earliest detectable signs of a neurological emergency. Let me tell you about a patient I will call Dorothy. 67 years old, retired accountant. She came to see me for a routine follow-up, blood pressure management, nothing dramatic. She sat across from me and mentioned, almost as an afterthought, that she had noticed a yellowish patch near the corner of her left eye for about 8 months. She had shown it to her hairdresser, who said it was probably just age. She had looked it up online and found the word xanthelasma, but then read that it was usually harmless and closed the browser. I asked her to lean forward so I could look. There was xanthelasma on both upper eyelids. She had missed the right one entirely because it was smaller. And when I looked at her iris, there was a faint but unmistakable grey arc at the outer rim. Arcus senilis, bilateral, at 67. 2 lipid signals on her eyelids and her iris, both present for months, both dismissed, both pointing to the same underlying problem. I ordered a full lipid panel including ApoB. Her standard LDL was 138, borderline. Her ApoB was significantly elevated. Her LPA came back at 94 nanomoles per litre, nearly 3 times the threshold that indicates elevated cardiovascular risk. Dorothy had a genetic cardiovascular risk factor sitting on her eyelids for 8 months. Her hairdresser saw it. Her previous physician had not examined her eyes in 2 years. I saw it in the first 60 seconds of her appointment. She is now under cardiology management specifically for elevated LPA. Her risk is being addressed. The xanthelasma are still there, they rarely resolve, but now they are a reminder rather than a warning. Her eyes spoke for 8 months before anyone listened. Here is the self-examination protocol I want you to follow. Once a month, good natural light, no makeup, mirror at eye level. Step 1. The whites. Look at the sclera in natural daylight. White and clean, normal. Yellow tinge, liver evaluation priority. Red beyond normal vessel pattern, infection or inflammation. Step 2. The conjunctiva. Pull the lower lid gently down. Deep pink, normal. Pale, washed out, anemia evaluation. The conjunctival pallor test takes 5 seconds and has been used in clinical medicine for over a century. Pull the lower lid down. If the inner surface is pale rather than deep pink, request a full blood count and iron studies at your next blood draw. Step 3. The eyelids. Examine the skin of both upper and lower lids near the inner corners. Any soft yellowish plaques. Lipid panel including ApoB and LPA. Step 4. The iris rim. In good light, look at the outer edge of the iris. A grey or white arc or complete ring at the outer iris edge in someone under 65 warrants a cardiovascular risk assessment. It is a lipid deposition signal that the bloodstream is oversaturated. Step 5. The gaze. From the front, do both eyes appear to sit symmetrically in the orbit? Any forward protrusion, any asymmetry in lid position, thyroid function evaluation. A comprehensive eye examination by an ophthalmologist, including dilated fundoscopy, takes approximately 30 minutes and costs between $100 and $200 without insurance. It reveals the retinal vasculature, the optic disc, the lens, and the vitreous. It is one of the most information-dense medical examinations available for the cost.
Adults over 60 should have a dilated fundus examination every 1 to 2 years, not only for vision, but for systemic health screening.
The retina is the only place in the body where a physician can look directly at your blood vessels and your brain tissue simultaneously without any invasive procedure. Most people over 60 see an optometrist for glasses and consider their eye health addressed. An optometrist checks vision and screens for glaucoma. A dilated fundus examination by an ophthalmologist looking specifically at the retinal vasculature for microaneurysms, arteriovenous nicking, and disc changes is a different examination. And it is the one that catches systemic disease before it announces itself elsewhere. Everything I described today becomes more diagnostically significant after 60. After 60, the liver processes bilirubin more slowly. Scleral icterus appears at lower bilirubin levels. After 60, anemia is more prevalent and more consequential. After 60, lipid deposits accumulate faster. After 60, diabetic retinopathy progresses more rapidly. After 60, the window between early detection and advanced disease is shorter. How old are you? Write it in the comments right now. I want to know who is watching, because the eye examination conversation at 58 is different from the conversation at 74. And what I cover next will be shaped by exactly where you are. Here is your action plan. Go to a mirror right now in natural light. Check the whites. Any yellow? Check the conjunctiva. Pull the lower lid down. Is it pink or pale? Check the eyelid skin. Any yellowish soft plaques near the inner corners. Check the iris rim. Any grey or white arc. And book a dilated fundus examination with an ophthalmologist if you have not had one in the past 2 years. Your eyes have been showing your health status every single day. 10 minutes once a month is all it takes to begin reading what they are saying. I'm Dr. Arthur Sterling. I've spent 15 years watching patients carry systemic disease in plain sight on their faces, visible, readable, actionable, while nobody looked. Subscribe, hit like, and send this to someone whose eyes deserve a closer look. The healthcare system waits for symptoms. Your eyes do not wait. They have already started talking.